Austin-Weston, the Center for Cosmetic Surgery, is proud to present the new You Now podcast, today featuring one of the founders, Dr. George Weston. And now, here's your host, Rebecca Bennett, and Dr. Weston.
Tips and tricks by Dr. Weston.
Sounds obscene, but I'll take it, okay?
How's it going?
Welcome back. Didn't we just leave?
Yeah. I feel like every time I see you, you're coming back from hanging out with horses. Did you get to see the horses today?
I will take a precious little girl to ride a pony this morning. Yes, right after this.
I love it. It seems like almost every weekend you do that.
It is every Saturday. It's such a delight. She goes. It's a social event for her and her little girlfriends. Mm-hmm. And they help each other saddle up their ponies, and it's just precious to watch. I don't really have to do anything. I just sit back and watch and laugh. That's all.
Well, today, before we get into the topic, I wanted to ask a question that I've always wanted to ask a plastic surgeon, and that is, when you're out in the wild, in the public, are you looking at people to try and figure out what procedures they've had done?
At this point, I don't have to try to figure it out. It just kind of jumps out at me, I guess. And I know the subtleties to look for to tell if someone's had something done. Sometimes it's just that I know they look too good, and I can't really tell that they've had anything done, but it just looks really, really good. And then sometimes it jumps out that either like an earlobe is pulled down or the face looks a little unnatural. And so I'm always in my mind as to, what would I have done differently to try to prevent it looking like cosmetic surgery, because I think if it looks like cosmetic surgery, it's not really good cosmetic surgery.
Yeah. So today we're going to talk about how plastic surgeons decide what to do when someone comes in and says, I want X, Y, and Z.
Yes.
So, for instance, if we start with like a facelift, and someone comes in, where do you even start with them?
It's kind of like a puzzle, it is, and you have to put the pieces together. Patients come in and they want... sometimes they have the thing that bothers them. It's either the neck or their eyelids. And then some people come in with a direction that they want to go. They want to look younger or fresher or less tired, for instance. And those are two different conversations, I guess. To make certain that you get an excellent result that doesn't look operated, there's kind of a paradox with that, and it's philosophical for me. It's I don't think that you can do half of a face and make it look good. I think it'll look half done. Nobody ever cuts half of the front yard and thinks it's going to look right, or paints half the house, or washes half the car, or brushes half their teeth. But every day someone comes in and they want me to do half of their face. They are either focused on their neck or their eyelids or whatever. And one of the paradox is that the more you have done at one time, the less done or less operated it will look. And so when patients come in and they either want to do the bottom half or the top half, sometimes the little brat in me comes out and I say, well, why don't we just do the right half? Because it's going to look half done, whichever half you do. And so I sit down with the patient, and our philosophy here at Austin-Weston is that we have a partnership with the patient, but the patient is the senior partner. And so what I will do is I listen to their concerns, and we talk about their anatomy and what's possible and what we can do, and the rationale for doing it a particular way, and then they choose. I can do half your face, and I do that sometime. I wouldn't do that, with my wife or sister. But if you want me to do half of your face, I'll do half of your face after I explain why you shouldn't do half of your face.
Yeah. So it's not like it's dangerous, because obviously you would say we're not going to do that if it's
no. And we can put your face on the computer imager and show you what it looks like to do half of your face.
No way.
Yes, or then we'll add in, the other half of your face, and you can see the difference
that's cool.
between doing it one way versus another way, and you can choose, what you think is the most important thing. And it's kind of like making a birthday cake. As an analogy, there's the cake, and there's the icing, and there's the candles, and then there's the flame on the candles. And so there's the basics for what you should do with, say, a facial rejuvenation to make it look natural and not operated. And then you can decorate the cake, like you can do lips, for instance. You can because the mouth ages as well as the face, and we ignore that a lot of the time. But there's things like lip lifts and corner mouth lifts and lower lip advancements and all these other little things that I would call the flame on the candle on the icing on the cake that can even make it look more natural or make it look younger.
And that imager must really come in handy. I mean, when did
I love the imager. We mostly do facial imaging and not so much body imaging. But I love it. It won't show you the result that you will get. It will show you
an idea,
the result that you can get. And so it just opens up possibilities for people to actually see it.
Right. I'll bet that also helps sort of move them in the right direction if they're thinking, I only want half my face done. You're able to kind of show them what it looks like.
So you can actually see what result you might get doing it different ways. And I think the thing that matters the most in how good a result you get is how good your surgeon is. I mean, there's your anatomy, but then there's how talented is your surgeon. And so you need to do your homework and choose your surgeon well, and choose a surgeon that does the procedure that you want to have done, someone who does it all the time. You don't want, for instance, someone who just does breast reconstructive surgery to do your facelift. We get really good at what we do every day, and so choose somebody that does it every day.
And I know that part of this, you wanted to kind of talk about these photos, starting with kind of like the female part of this side of the face, sideburns.
It's very important. There's the design of anything, even a facelift, and then there's the execution of it. And so in some of these photographs that you see, if giveaways for cosmetic surgery is if the sideburn is pulled up on top of the ear, then that's bad design. If this little piece of cartilage right here is pulled over and flattened in front of the ear, it can make it look unnatural. If the earlobe is pulled down and attached to the side of the cheek, like the one of Glenn Campbell's that you can see, that is bad design and bad technique, or the scar down the nape of the neck. And so my analogy would be, you might be really good at climbing a ladder, but if you've got it up against the wrong wall, it's not going to turn out well. And so a lot of it is design and not just execution.
I'll bet it's also a case-by-case basis, right? The way people are, it's not just a one-and-done type performance for everyone.
Absolutely. It's everyone's anatomy is a little bit different, and so we take that into consideration and try to make certain that we make it look as natural as we can.
What about other parts? I know we talked about the face. What other parts of the body that someone might ask for require a lot of consideration?
We do a lot of breast surgery, and so women come in and they want, say, a breast augmentation, but their breasts droop. And so if you just put an implant in a droopy breast, you get a bigger, droopier breast. And so sometimes you have to suggest, well, you could benefit from a lift as well. And then there's, what kind of lift. And so the patient has to be willing to have the scars in order to get a better shape. And so there's scar versus shape in a breast. And sometimes it takes more incisions and more scars to get a perky breast. I think one of the biggest mistakes that women make is probably choosing too big of an implant. There is size versus shape, and at some level, bigger is less shapely. And there is a line somewhere, and it's probably different for every breast. But at some point, a bigger implant goes too high, and the higher that it goes, the lower the nipple looks on the breast. And so all those women that you see on the red carpet with breasts up here, up to their neck, I promise you, that looks good in a low-cut dress, but when they take their clothes off, their nipples are not at the top of their breast. They're not perky. And so there's a balance somewhere. What we do is we measure the width of the breast, and the implant should fit that space just the same as your foot in your shoe. And so if it's too wide, the implant, when you put it into a smaller space, is either going to curl up and wrinkle and weaken the implant, and it will fail more commonly, or it's going to be in your armpit, or it's going to be a uniboob, or it's going to be down here on your abdomen. And so it needs to fit the space. And so we help the women to choose a size of a breast, but ultimately you get to choose what size you want. And sometimes in the operating room, I feel that it's too big of an implant and it's not going to be shapely, but some women are more interested in size than shape. And so I don't choose for them.
How often are you having to decide between whether to perform a surgery, to cut, or to choose an alternative that might be a little bit less invasive?
No one wants surgery. We just want the results of surgery, right? So, and nowadays we have different alternatives that are non-surgical. We have Botoxes and fillers, and I guess what we all want is a minimum procedure with a maximum result with no recovery period that doesn't cost anything. Unfortunately, I don't have one of those. And so one of the misconceptions is that you can get a surgical result with a non-surgical procedure. Mm-hmm. And so they've come out with all these non-surgical, skin shrinking and fat melting procedures, but they will not give you a surgical result. Like, for instance, cool sculpting or Sculpture, and then we have one of those machines as well. But the best that you can get from one of those procedures is somewhere, say, between 20 and 25% result as compared to liposuction or a tummy tuck. Mm-hmm. And so if you're willing to have a 20% result, then maybe that's a procedure for you. But my patients don't want a 20% result.
Right.
They want the best I've got.
That's why they're going to you.
Right. And so we try to give them 100% result if we can.
And how often do you see patients that might have had, maybe had gone to another plastic surgery practice and not liked their results and then come here to have you fix them?
I see that occasionally. I don't see it, that often, actually. I guess the surgery in this area is pretty good because I don't see many complications from other surgeons. Every now and then I'll see, what I consider to be mediocre results, whereas we're trying to give you an Olympic-style result here. And so, and sometimes I see patients that are unhappy with their results that have beautiful results from other plastic surgeons. Mm-hmm. And I go, I'm sorry, I can't improve that. Mm-hmm. Your surgeon did a great job.
Wow.
Go back and talk to him if you're unhappy with it. And so we treat everybody like we would our wife or sister and give them the best that we can. And I'm not trying to sell them anything. I'm trying to give them what they want rather than what I think they should have.
If someone comes in with a bad case, like a not as impressive case, how often are you having to kind of turn those guys away? Is it more dangerous to kind of operate on a place of the body that's already been operated on?
Sometimes it's more difficult if someone's had surgery and they have scar tissue, say, under their skin, and it makes it stiff rather than flexible when you operate on it. but we can improve darn near anything, and I can't make it perfect. And like Dr. Poindexter said, sometimes if it's a difficult case, we get everybody's opinion. I'll get Dr. Poindexter and Dr. Siegel to come in and go, what do you do with this? And because there are different options, there's not one way to do things. Mm-hmm. Sometimes, there are 2 or 3 different things you could do.
Well, thanks for sharing your tips and tricks.
Tips and tricks, yeah.
Tips and tricks by Dr. Weston.
Sounds obscene, but I'll take it, okay?
Hey guys, thanks for tuning in to this episode of Austin-Weston's New You Now podcast. If you liked what you saw or heard on today's episode, please like and subscribe to our channel. And if you have any questions about any of the topics we've covered today or in past episodes, send us an email at hello@austin-weston.com or just leave us a comment below. See you next time.
For more information, visit austin-weston.com or call our offices for a consultation, 703-893-6168. And make sure to subscribe to our podcast series, Austin-Weston, the Center for Cosmetic Surgery.